The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan. It's a pleasure to be hosting the podcast, and thanks to everyone for listening in. This week, we are going to be talking about Dr. Oz. We call it Lessons from Oz. Dr. Mehmet Oz is the nominee for CMS Administrator. He appeared before the Senate Finance Committee on March 14th. Contrary to popular perception, Oz articulated some things that show the Trump administration could be very different than we thought it might be. Closely crafted nomination hearings are occurring. This means that Trump is telling his nominees to toe the Trump line, do not say things that fundamentally conflict, and again, it's carefully scripted. So what the nominees say at their confirmation hearings is likely to be what could emerge as policy. I have told you that I do expect some things to happen on MA and drug price negotiations that run contrary to perceptions. You can see my earlier blogs and podcasts on this at healthcarelabyrinth.com at the blog and podcast site. Oz's appearance and what he said on these topics, meaning MA and drug price negotiations, really underscores what I've been saying, that things could be very different. We'll take our usual 3 breaks and we'll split this up to make it digestible. We're going to cover 3 main topics here today. Medicaid and exchange cuts, which Oz's responses were pretty typical, and then Medicare drug price negotiations and later Medicare Advantage reductions and reforms. And in those 2 cases, his responses were a little atypical and signals some odd changes on the part of the Trump administration. So let's get right into it. The confirmation hearing of Dr. Mehmet Oz, again, who is slated to be administrator of the Centers for Medicare and Medicaid Services, if confirmed, is a lesson in changing political dynamics. It also tells us that sometimes the people most supportive of a given program may be most apt to reform it. That's the case in Medicare Advantage. Let's break down what occurred at Oz's confirmation hearing in front of the Senate Finance Committee. What is interesting is that many of the folks on finance are also members of the other healthcare committee of cognizance, which is known as HELP, the Health, Education, Labor, and Pensions Committee. We cannot touch all of the ground covered, but let's hit the top issues here and why in most cases Oz's responses run contrary to what we may have thought. As important, Dr. Oz comported himself very well at the hearing and came off as very knowledgeable on the healthcare system, Medicare and Medicaid. This is juxtaposed with his future boss, Health and Human Services Secretary Robert F. Kennedy Jr., who struggled to detail the basics of Medicare and Medicaid at his 2 hearings. There was also little mention in the hearing of various conflicts of interest that Democrats have raised and levied against Dr. Oz. Opponents of Oz's nominations appear to be losing the fight to stop him from becoming the CMS administrator. With that brief intro, we will jump into what Oz said on Medicaid and exchanges after our first break. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this edition of the Healthcare Labyrinth podcast. Let's jump right in on the topic of Medicaid and exchange cutbacks and what Dr. Oz, the nominee for administrator of CMS, said at his confirmation hearing on March 14th. Oz's comments on the exchanges and Medicaid were quite traditional and again towed the Trump line. While Trump and some GOP lawmakers have said that the Budget Reconciliation Act will not make fundamental coverage reductions to Medicaid, the House healthcare spending reduction target is sizable, some $880 billion over a 10-year horizon. The big question is, how will the GOP thread the needle to hit savings but not fundamentally impact coverage and keep their promises on Medicaid coverage? The GOP wants to focus on work requirements and fraud, waste, and abuse, but might have to go after other areas of Medicaid that may do more to impact coverage in the program. Leading contenders on this front are reining in provider taxes, as well as some changes to state reimbursement in the program. The Trump administration also proposed some rather major reforms to the exchange program, which will reduce coverage there. It also has largely remained silent on extension of premium subsidy enhancements, which leads one to believe the administration wants them to lapse due to costs. Oz at the hearing was sensitive to the balancing and largely stayed away from controversy. He did not make commitments to protect Medicaid funding and refused to be baited by Democrats. He took the long view, which is generally smart. Quote, I want to make sure that the patients today and in the future have resources to protect them if they get ill. The way you protect Medicaid is by making sure that it's viable at every level, unquote, he said. He also focused on fraud, waste, and abuse, work requirements, and removing undocumented residents. He argued that the program is inefficient. He also called out poor reimbursement in Medicaid to many providers, which impacts access and quality. He refused to endorse the extension of enhanced premium subsidies in the exchanges. With that fairly typical response, when we get back from our second break, we'll tell you about how his response to Medicare drug price negotiations was a bit atypical for Trump and for Republicans. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We are talking about Dr. Mehmet Oz's recent appearance in a confirmation hearing to be administrator of the Centers for Medicare and Medicaid Services. And we're now going to talk about Medicare drug price negotiations and what Oz said. Popular wisdom during the campaign suggested that a Trump 47 administration would seek to either repeal or fundamentally change the Medicare drug price negotiation law. After all, passage was along party lines during the Biden administration. Conservatives have been agitating for repeal of the law, and the GOP is firmly in the hip pockets of Big Pharma, at least until now, it seems. Trump has always had novel views on drug pricing given his populism. In Trump 45, he proposed negotiations for Part B drug pricing as an initial step to international reference pricing. Under international reference pricing, prices are set in one country by taking into account what is paid in other similar countries. Trump actually wanted the most radical of approaches in international reference pricing, known as most favored nation status, where America would receive the lowest price of any other country out there for given drugs. Trump said he wanted to extend the program to the Part D retail program as well. The program was adopted late in his administration and was pulled back on by President Biden due to complexity and some challenges. During the campaign, Trump seemed to equivocate on the drug law and his views on drug pricing, leading to rumors he would back repeal or substantial change. Since returning to office, however, Trump's CMS has announced it is proceeding with the second year of Medicare drug price negotiations, and it kept the 15 drugs or so proposed by Biden. The administration also kept Biden-era lawyers to defend the law in court. Trump appeared on Fox on Super Bowl Sunday to bemoan the high prices of weight loss drugs and to declare the inequity compared with other countries. At his hearing, Oz left little doubt that the Medicare drug law is here to stay. Confirmation hearings responses, again, have been carefully scripted by the White House, so there is no doubt Oz is speaking from the Trump Bible. Oz said he would defend the drug law in court. Oz stated, quote, "It's the law. I'm going to defend it and use it," unquote. He added, quote, "We, I believe, in order to protect the American people, and President Trump's been very clear on this, want to reduce the cost of medications to our government and to the American people. That's not happening right now. We can do better," end quote. Oz said he supports greater transparency in pharmacy benefit manager pricing practices to help lower drug costs as well. He also noted that it is one of multiple approaches he would pursue to lower drug costs. And he even signaled at the hearing an openness to international reference pricing. Big Pharma had to have begun drinking early after Oz's testimony that day. What has emerged is an odd coalition of progressives who passed the Medicare drug price law and Trump populists that look ready to defend the law and perhaps further it, given the huge price disparities between America and other developed countries. It taps into Trump's views that American consumers are constantly being ripped off by the world, and the free ride has to stop. His tariff plan also could increase prices for drugs and potentially lower sales and raise the temperature on the drug price issue. As such, some major drug makers have begun making commitments to production in America, essentially re-onshoring production, and made soft commitments to lowering price. This is not to say that there may not be tweaks to the drug price law along the way. Trump seems sympathetic to exempting small molecule drugs for a longer period of time from negotiations and appears ready to bring stakeholders to the table on negotiations and bringing greater transparency. But there's no question with Oz's testimony, again, that the drug price law is here to stay, and Big Pharma has to be quaking in its boots. With that, we'll take our third break and come back and talk about MA cutbacks and reforms. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about Dr. Mehmet Oz's recent appearance before a confirmation committee to be administrator of CMS, and some of his statements, some of them pretty traditional Republican and Trump, and others, like in the case of Medicare drug negotiations, and now what we'll talk about, Medicare Advantage reductions, are a little atypical. And so let's talk about Medicare Advantage cutbacks and reforms. In an op-ed in Forbes in 2020, Dr. Oz and a co-author said MA offers better care due to the competition in the program and endorsed expanding MA to all Americans who are not on Medicaid. But the MA proponent has signaled a clear understanding of the program and actually is now endorsing reform. During his confirmation hearing, Oz went out of his way to single out MA as one of the biggest sources of waste and abuse within the healthcare system. He clearly had read up on MA overpayments and other flashpoints in MA. He cited various reports showing spending on the private alternative as well above the traditional Medicare fee-for-service program. He said things were, quote, upside down, end quote. In response to a question on whether he would rather cut waste, fraud, and abuse in MA or cut funding for Medicaid, Oz agreed that, quote, the former sounds like a more rational way to do that, end quote. He singled out a few areas for reform in MA. First, overpayments and risk adjustment reform. Second, prior authorization and denials. Third, supplemental benefit utilization. And fourth, marketing and enrollment reforms. Let's take each of them in detail. Now, I question some of the opponents' reports of overpayments and the magnitude of them, but Oz clearly read them and is concerned. Oz spelled out the practice of upcoding within MA. He said, quote, a part of this is just recognizing there's a new sheriff in town. We actually have to go after places and areas where we're not managing the American people's money well, end quote. On overpayments and risk adjustment upcoding, Oz was blunt, saying, quote, I think the upcoding in Medicare Advantage programs has become the best example of this out there and is something that is addressable. And I pledge, if confirmed, we'll go after it, end quote. Oz tied overpayments to the rebate plans received to add to supplemental benefits and drive enrollment. He wonders if the rebates are too much and more savings should go to the federal government rather than benefit additions. Quote, we should examine whether some of that money should be reimbursed to the American people to ensure that Medicare Advantage does not cost more than fee-for-service Medicare, end quote, Oz said. On prior authorizations and denials, Oz criticized health insurance plans in general for liberal prior authorization policies, arguing care and treatment are being delayed. He defined it as, quote, a pox on the system, end quote. Oz exhibited detailed knowledge in the area due to his being a provider in the healthcare system. He called out the following specific to MA and broke things down at a level never before seen on Capitol Hill from an administration nominee or official. While I am a proponent of the correct use of PA and MA, after all, this is managed care. Oz made some brilliant points that should be investigated. First, he thinks Medicare pays for about 15,000 services and procedures that could be subject to prior authorization. Second, he says plans use pre-authorization for about 5,500 of these procedures. Third, but not all insurance companies focus on the same things, he says. Fourth, even within the same procedure, Oz says the criteria for authorizing a service are not the same. Fifth, Thus, he says it's very difficult to automate PAs, and thus they are misused and approvals are stalled upfront and for claims payment. And last, he would limit PAs to about 1,000 common services or procedures. Oz argued for streamlining and standardizing the PA process and making it more transparent. As well, he would then use technology and appropriate AI to speed PAs, even making them real-time for the more limited PAs he would allow. He stated, quote, "We're spending money, wasting money, trying to do a process that should be automated. I would argue we could limit the number of pre-authorized procedures to 1,000, end quote. The Biden administration already has put sweeping restrictions on PA and MA, but we can expect more scrutiny and changes under Oz. It also appears that prominent conservatives and liberals in Congress favor additional changes here too. The provider lobby has done a profound job here, and the plan lobby has absolutely no traction in defense of the reasonable use of PA. Oz's points on standardization and streamlining, again, are fair ones. Oz expressed concerns about MA sales and brokers encouraging seniors to switch plans, not because it is in their best interest, but for the financial gain of brokers and agents. He suggested considering multi-year enrollment options. Quote, "There are ways for us to ensure that the marketing process works better for the folks involved," end quote, Oz said. The Biden administration attempted to reform here on the agent and broker compensation front, but it was struck down in court. It seems to me these would be good reforms as well. Again, popular wisdom suggests that the Trump administration is very pro-MA and health plans would have a free ride under Trump 47. Oz made clear that it is not the case. Oz, Trump healthcare policy advisors, liberal lawmakers, and anti-corporate welfare GOP lawmakers have all set their gun sights on MA for different reasons. It is not to say that Trump might not offer some upfront concessions to help the struggling MA industry, but reforms and reductions will be made. As Oz stated, quote, "If confirmed, this will be one of the topics that is relatively enjoyable to go after because I think we have bipartisan support," end quote, he said. With that, we'll conclude this edition of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.